Why can concussion symptoms come back years later and worse than previous with no current injuries? They can't. So if you're having a relapse of symptoms with no injury whatsoever, it means that the symptoms you're experiencing are due to something else. And that's like most chronic concussion patients. Most chronic concussion symptoms are not concussion. They're not related to brain dysfunction. And actually, that's what we talk about in our workshop. And that's why concussion is actually a treatable thing. And most people don't know that. Most people look at concussion and think that it's permanent. But the reality of the situation is that concussion is treatable. You just have to figure out why the symptoms are being caused. And it's not because of brain injury, right? Concussion causes a temporary drop in energy levels in the brain. That's it. Temporary. 3 to 6 weeks, as far as we know. After that, it's either blood flow, which is like autonomic nervous system stuff, or like your blood vasculature and how you respond to increases in activity. It could be inflammation, it could be hormones, it could be your visual system, vestibular system, it could be your neck, or psychological, meaning anxiety, depression, PTSD, all these same things look like concussion. So what you may have experienced as a concussion now might just be a generalized anxiety disorder that's causing the same symptoms. So after basically 6 weeks, it's not brain injury anymore. It's something else, right? And all of those things that I just mentioned are fully treatable conditions. And that's the thing that people need to wrap their heads around when it comes to concussion. So you patients out there that are sitting there being like, I have a brain injury. No, you had a brain injury. That is past. Now you're dealing with something else. And if you can figure out what it is, you're able to treat it. But the more you hang on to that idea of, this is who I am, and you adopt that sick role, which a lot of patients end up doing, that prevents you from being able to actually get better, because concussion recovery requires you to push beyond certain things. And if you sit back and feel that you can't do certain things because of brain injury, it's going to actually create some disabling things for you. So this person just asked, where does post-concussion syndrome fit into that? That is post-concussion syndrome. Post-concussion syndrome is chronic concussion symptoms. That's the same thing I'm talking about. So post-concussion syndrome is not brain injury. Post-concussion syndrome is something else. Whether or not that is, like I said, blood flow, hormones, inflammation, visual vestibular, cervicogenic, meaning the neck, or psychological. In there, you'll find your answer. And it's often a combination of those particular subsets. So that's what you really have to figure out, is where are you in this? And that's exactly what I'm talking about with this workshop, is that I'm trying to take rehab professionals through that exact thought process to say, here's what it could be. Here's the 5 things that it could be. And here's how I'm going to walk through each one of them to make sure I don't miss anything. And all you're doing is ruling things out, crossing them off your list, right? And this is what all of our complete concussion management clinics do. This is what we've trained them to do all the way through, is to say, okay, you had a concussion. Now you have persistent concussion symptoms. What could it be? What's driving these particular symptoms and issues? And then it's just, okay, you do this test. Nope, it's not that. Rule it out. Okay, now it's over here. You do this one. No, it's not that. Okay, now it's this one. Okay, yeah, there's a little bit of that. Let's start doing this. Here's some rehab exercises and things to do for that. Okay, now it's not that. Now let's check over here. And so it takes you through this entire process, right? Because if you can't figure out what's actually causing the symptoms, you're never going to be able to get your patients better. And that's kind of the whole idea behind why we've launched this workshop, because that is what's going to help our patients. That's what's going to be able to help our patients to get better, is finding appropriate healthcare professionals in their area to actually go in and figure out what's going on. Why do you still have these symptoms?